Hi everyone, Dr. Wayne Saltsman, geriatrician and elected member of the Burlington Board of Health, coming to you again this week to help you stay informed, feel supported, and be prepared around this COVID-19 pandemic. As in previous weeks, a number of new issues have come up that I'd like to talk to you about, but first, as always, let's talk about the numbers. Across the world, greater than 3 million confirmed cases of COVID-19, but over 1 million people have recovered. In the United States, 1 million confirmed cases from 6 million tests. And in the state of Massachusetts, 275 tests with 62,000 confirmed cases, 12,000 confirmed cases in long-term care from both residents and healthcare workers. 57% of the deaths in Massachusetts from COVID-19 have been due to folks who live in long-term care settings. And I have to tell you, as a geriatrician, I have spent the majority of my career in these settings where people call home. And I know of their vulnerability, and now we all know because of COVID-19 about their vulnerability. And I think we all can appreciate now how it's going to take a village to pay a little bit more attention to these folks moving forward. As we know, the national mandate for mitigating COVID-19 has been lifted, and states are pretty much on their own for dictating their paths. And Massachusetts is taking a judicious path to make sure that when we do emerge, we're safe in doing so. And the Burlington Board of Health is upholding that guidance. But there have been some issues and concerns about wearing masks in public. As you know, I am an advocate, and I do wear a mask in public. Folks have thought that we should mandate masks, as they have been in other towns. As we talked about at the last Burlington Board of Health meeting, and as our selectmen discussed, the idea of mandating is difficult. How do we enforce it? What happens if somebody isn't wearing a mask? What do we do? I am still for the understanding that we are all citizens within a community, respecting each other and wanting each other to be well. And wearing a mask, along with social distancing and other precautions that we always talk about, is really the way I think we need to proceed. But the Burlington Board of Health is always willing to talk more, and we welcome comments. There's been more information about treatments. Remdesivir is the latest medication that's in the news. It has been shown in appropriately run clinical studies that it may reduce the number of days of recovery, which is great. And if anything, we should all be encouraged that clinical studies are underway. Nothing definitive yet, but at least people are actively focusing on how to treat this disease. With regard to vaccinations, we heard that the central administration believes that perhaps, because of the work that's being done across the world, in the January of 2021, we may actually have a vaccine. Again, wonderful. But remember, it takes time to make sure something is safe, effective, and can be produced in large quantities. I hope that we're there in January. But until then, same issues apply, issues that should now be part of our normal lives. Hand washing, hand washing, hand washing. Protecting your cough and your sneeze. If you're sick, quarantining yourself. Cleaning surfaces. Social distancing. If there is an older adult that you think could be helped by your call, please make a call. We're all in this together. Stay safe and be well.